Our idea is that crisis moments, they change something, they change practices, and they might also change policies in the longer run.
There has been a big increase in especially biomedical waste, and including protective equipment. There's also a big impact we see in terms of stigmatizing waste workers, as they are really directly and bodily in touch with the matter, that people stigmatize them as being like vectors for further infections. And as in South Asia, there intersections between caste, gender, and other categories are quite stark. Probably it has also increased the stigmatization of being kind of unpure.
Yeah, my children always laugh and tease me. Their father is a garbage researcher, and they wonder why the taxpayers should pay for that. However, it's actually quite serious. Waste is reflective of power relations, of politics in a given society. What type of population is exposed to the waste and what populations are protected. And that's why lots of social scientists like me are quite passionate about waste.
Basically, what you do is to walk along a certain path, so that's why the transect, and you observe and talk with local communities and really experience what that territory and that particular object does to people and the landscape. But basically, we follow or trace back, for example, waste, and really trying to understand its metabolism and its significance for the different stakeholders.
Now, most of the fieldwork will be carried out by our local research partners. However, that will also be complemented by research by a PhD student who will be recruited in Switzerland. When one comes from the outside, one is often very naive and asks the very stupid questions. However, these stupid questions are often very important questions, because when one is in a particular context, one does not really realize some absurdities sometimes that are going on.
So as this research is really field-based and requires access to the field in many different ways, to people, to territories, to political institutions and governance institutions, really negotiating access in the local situation of curfews or lockdowns or limited mobility is going to be a challenge. And of course, adaptability is like the greatest imperative now for researchers at this time.